Just looking at this independent of any political filter as best as I possibly could. Because I'm a father, I'm a husband, I also own a business. I've got employees here. I cover their health insurance. They rely on my health for them to have things like health insurance, right? All right. So what I'm about to share with you is a collection of the information that I discovered last night. And this is going to be commentary free. And then it will pivot towards the end where I will add my own commentary, but I will let you know when that occurs. All right. So what I'm about to share with you, this is commentary free. This is information I'm sharing with my own family. And I love all of you, but not as much as them. So if this is what I'm telling them, it's really, really what I was able to verify and believe to have enough truth that I should share this with my loved ones. Okay, let's begin. Coronavirus is not the flu. It is more than that. It's also not the stand. This is not an apocalyptic event, nor will it be unless the virus mutates into something unforeseen. However, that is a danger with any viral outbreak in all of human history. That can happen. Number two, it is quite likely most of you watching or listening right now will get coronavirus at some point in your life for the same reason most of us will get the flu, a cold, etc. The main concern here is not the virus itself, but the instant strain it could put on our healthcare system. That is what occurred in Italy. And while our healthcare system is superior to theirs, this is not commentary. They essentially have the Bernie Sanders healthcare system in Italy. That's what they have. That is not commentary. It is a fact. So while our healthcare system is superior to theirs, any system, any human system can only handle so much strain. The worst projections, and I mean the absolute worst that I could find from a credible source, are as many as 460,000 Americans could die from this outbreak if it's not properly contained. To put that number in perspective, that is 200,000 fewer, more than 200,000 fewer Americans that die of cancer each year. However, the concern is that this could happen over the next few weeks and months all at once, like a cancer blizzard, instead of over the course of a year, sort of like getting an entire winter's snowfall in one storm. What would that do to your community's snow removal infrastructure? That is the concern. Especially because so much of our medical equipment, medicines, and other infrastructure has been outsourced for cheap labor and production to places like China. In fact, some of the Pentagon's medical relief that it relies upon comes from China for our soldiers. From Puerto Rico, which of course you'll recall had a massive cataclysmic hurricane there about a year ago. That means we are behind on restocking necessary items. That is the main concern, that people will die because we aren't equipped for the overflow that may occur. Actual mortality rates, and you saw that in the testimony on Capitol Hill just a moment ago in Aaron's montage. Actual mortality rates are tough to nail down because the virus isn't so much an independent killer. Again, this isn't Captain Trips. The virus isn't so much an independent killer as much as it can kill those with already vulnerable health. That's why the elderly are at such high risk, for example. China has an extraordinarily high smoking population, and this is a respiratory virus. So that's one of the factors over there. Italy has less of a smoking population than China, but still larger than ours. And then we have an obesity problem, particularly for people over the age of 55. So it depends on the general health of your family and community. So when you're seeing stories, for example, that say 1%, 3%, like that's a blanket number across the board, it is not. That's very important to understand. There have been some locales where because of the general health of the populace, the number is in decimal points. And then there have been some locales because of the general health of the population, the number's been 6 or 7%. So that's just, they're just leveling off the average. It's not that simple. We all don't have the same health. Certain areas have higher obesity, higher elderly, more smoking, etc. All right, so it's not that simple. Therefore, your best defense is to take your own health seriously, as you should always do anyway. The healthier you are, the less vulnerable you are. The less you may need to access the healthcare system if indeed it ends up becoming strained. Because if they're overrun with coronavirus, that obviously takes time away from other ailments and maladies. That is why emphasis on things like hand sanitizer. You're seeing that. Disinfectant wipes. Now, it's unknown if these disinfectants actually kill this virus. But the more you can assure that you are healthy, the less you need to be concerned, the less likely you'll be a transmitter, even if you're healthy. Same with wiping down doorknobs, countertops, etc. A vaccine could be ready for trial at any moment. That's not the issue, how soon they can produce one. The issue is it could take months to years to test that vaccine to make sure it is safe for mass consumption. Because you run into the law of unintended consequences here. What are the side effects of the vaccine? There haven't been mass school closings because about a third of the nation's nurses have children in schools. And the concern is closing them now, blanket closing them now, may cause a further shortage of healthcare workers who need to stay home with their kids. You may say in response to that, well, hey, we have summer vacations every year in their home. You're right, we do. And you would assume families make accommodations for that on a perennial basis. We're not in the months of June, July, and August right now, though. We're in the months of March, April, and May, when they don't have those accommodations at the ready. Speaking of healthcare workers, they're going to get the latest information first because health is a priority. Their health is a priority so that they can help other people. Therefore, keep up to date on what life choices you see healthcare workers, that your family's with, friends with, neighbors with. Keep up to date on the choices that they're making. Social distancing is being urged, not because people will die for attending a college basketball game. There's liability concerns that are driving that. Okay? But in the hopes of slowing down any potential outbreaks so that we don't overrun our clinics and hospitals all at once. If you're healthy, you have very little to worry about. But if you're obese, elderly, or otherwise unhealthy, stay home much more often and stay away, as the president urged last night. And now what follows is my commentary on this matter. The virus is very real. And we've told you this all week. The precautions being urged about your health are also pretty much what we've been urging on this show all week. Do not let your disdain for left American media cause you to just disregard this as fake news and put yourself at risk. Don't do that. Don't fall for the false choice. Don't be a sheeple. We're going to talk about that here in a moment, okay? Don't be a sheeple, but don't be a fool either, okay? That being said, the panic left America media are stoking here over this is very much fake news. Turn off all your cable news, even Fox, because they're going to be triggered by what's said on the channels that hate the president and then trigger you, because this is all now going to be. And the president tried to call for unity last night. That lasted for 10 seconds. And then it just became your typical Hannity grope session, and every other channel was dreadful. Okay? So this is all going to be Trump. It's not the Trump virus. All right? And Donald Trump, your loved ones hopefully are going to be here long after Donald Trump is gone from the White House. All right? Or reelected, whatever the case may be. This is about you and your loved ones. Live your life. Turn this noise off. Extend the precautions you make with your families during a typical flu season for another few weeks or months. Practice good hygiene, both personally but domestically. Right? Get active. Eat healthier. You could see health clubs close. Who knows? The good news is the weather is getting warmer around the country. Go outside. You can work out there. You push-ups in the driveway. I know I've done that many times, right? Load up on vitamin C. Make sure you're not vitamin D deficient. Those are the two vitamins that do the best to boost your immune system. It's about prudence, not panic. It is about prudence, not panic. It's about prudence, not panic. And one more time, it is about prudence and not panic. Finally, this confirms our globalization and outsourcing have gone way too far. People may actually die from this who should not, simply because we have handed over our national sovereignty for cheap labor and cheap goods. When this is over, there needs to be a national conversation about this once and for all, an adult conversation about handing over voluntarily way too much of our national sovereignty that has left us vulnerable to a situation like this. That is the end of the information I gathered and then my own commentary.